Hey there. Good morning, folks. Brian Singh here. Yep, no beard. That explanation is coming up shortly. I've just started the process of dilating my right eye, and I'm headed to Visitech at their further location, not the Green Park one, to get my second eye surgery. Today, I'm going to get it done on my right eye. It is now just at 7:50 in the morning. My Uber driver should be here, and I am off to the hospital. So let's go. Well, that was weird. Beard's still here. While here in Delhi, because I'm here for a stretch of time, I decided to have eye surgery, and I'm getting my lenses replaced. I've already had one surgery at this point. A little bit of history. I started wearing glasses before I was a teenager, and I had LASIK done in 2000 when I was 36. I loved it. I got rid of my glasses and I went on a sunglasses buying spree. Bit of false economy there when you get eye surgery. My eyes started to deteriorate again. In 2017, I got monovision glasses. My eyes deteriorated in a very odd way where I had one eye that was nearsighted and the other one long-sighted, which led to me now getting progressive lenses. I really dislike wearing glasses. After being without them as an adult, it's been great to get rid of them. And having them again was a little depressing. I always thought about getting the surgery, but I never really did more than contemplate it. But while here in Delhi, I didn't come here for medical tourism reasons. I came here to travel around the country with my sisters, and we had a great time. But I stayed on a bit extra. The first thing I did after they left was I went to Visitech Eye Center for an assessment. And 110,000 rupees per eye. And if I got the surgery done in Canada, it would be in the ballpark of about $10,000 as cosmetic surgery. If I had it as part of my regular program and I did qualify because of cataracts, it would be at a much lower rate because Canada has pretty damn good public health care when it works, but for things like this sort of surgery, it's I'm doing it purely for cosmetic reasons, but I also was in the pre-cataract phase and I just wanted to get ahead of things. I'm getting a lot more proactive with my health. As you can tell with all my videos, health is very central to food and travel and everything that I do. It is one of my pillars that helps me organize my life. So getting ahead on my eyes and getting the lens replaced, that really falls in line with that too. One thing I do want to emphasize, a lot of people have a lot of trepidations about going to medical facilities in countries that they regard as the third world or the lesser developed world. Look, I do medical procedures in Trinidad, where I grew up. The healthcare system there, again, it's a two-tiered system. If you have a bit of money, it's great. If you don't have money, it's actually pretty good. But in India, oh my word, all the routine type surgeries and procedures, they are fantastic. Look, they have 1.4 to 1.5 billion people here. They have a lot of practice doing these surgeries, and there's a lot of people with glaucoma and cataracts here. So they have all the equipment. It's very modern, and you'll get to see that. And I have nothing but praise for Visitech. They have been so professional. They've guided me through the process. They've instilled a lot of confidence. The surgeon, the bedside manner is absolutely perfect. Look, everybody everywhere around the world has access to almost the same exact medical training. You are going to have some differences in types of facilities and resources, but you get to taste a little bit of how things are being done differently in the world. I don't know how the hell dental and vision have been taken out of the healthcare system. Most probably because their associations have been very good at lobbying for them and ensuring that they get the maximum dollar for whatever they do. We all have opinions on that. Some of the things I'm not happy about, especially when you get, every 2 years you get a pair of glasses and, here's $100. You have a look at the price of glasses these days, it's ridiculous. Dental work, they nickel and dime you for everything, and they reject every claim if they could. If you don't have the right plan, you basically shit out of luck. I don't have the perfect plan. So for instance, I sleep with a splint. I sometimes call it a night guard, but I think the splint is the correct term for it. The difference is here I get one made, and really made better than anything else I've had done in Canada, for $60. For that same splint in Canada, it cost me $600. And my health insurance does not cover it. I actively encourage you that if you are in a situation where you are thinking about these surgeries, India is pretty good. I hope that you take a look at the procedure and the facilities, and also the manner in which I was treated. Done very quickly. It's less than 10 minutes. The pre-care and the aftercare is absolutely perfect. Let's get on with the day in terms of how the surgery goes. Part of the dilation process for my surgery. Well, here I am at Visitech. It was in the producer drives, and Delhi is quite the polluted city. The air has a lot of texture, and you really feel pretty unhealthy breathing it. I saw somebody tune this, and that's how you open it. Nobody's going to give you a helping hand here in India on some matters, and this is definitely one. They open. Doesn't look like they open just yet, so I have to wait. One thing you have to get used to in India is that people just call when you need accurate information, that they are also not inclined to give you a text. So it's a little bit different here. They gave me a call yesterday, urgently, please sir, come on here for 8 a.m. That was my early start. I was originally scheduled for 9 a.m. So I'm going to see what time they're going to open here. I am early though, so please keep that in mind. One more set. It does get into your bloodstream touch, and it imparts a bit of a weird taste on your tongue. But it's all part of the prep for the surgery. So I've handed my file to the assistant over there, and just waiting. I applied another eye drop just now. So things are happening here. Glad to say. This does feel a little bit older here, but because I came here first thing in the morning, they're just getting set up, so they're just getting into their rhythm here and just getting me prepped. Another thing is I did opt to come here on my own. My friend Edgard came with me on Saturday, and everything went generally well. This one was probably about 25 minutes drive from his place, and as I'm on my own, I wasn't too sure when to book my Uber to go back, but they're very good about the little aftercare after the surgery, making sure that you're comfortable. Eye is quite dilated. When I did the surgery last Saturday, it's Friday now. Surgery's at the Green Park location, which is near Housecast. Really slick center there. A lot of English-speaking administrative assistants, really on the ball. They do surgeries there Tuesdays, Thursdays, and Saturdays, and then they do them here on alternating days. I'll be doing the follow-up at the Green Park location tomorrow. There's always a 24 hours check-in to see if the lens was put in correctly and if it's settling in. And you can see the setup there. Okay. Little resting area here. I'm going to use the bathroom before the surgery. Seems as if I'm first in line here, which is good. So I'm here, they just took my blood pressure, and they put another final eye drop in, and just getting prepped for surgery. There you go, 10 past 9, and I'm done. It's a fairly routine surgery. It was all done in about 7 minutes. So they put about a just under 2 millimeter cut to the eye. But what happened at the time when I left now is I got assessment lining up where the lens is supposed to be, and that I had to leave the room for. I also got more drops to numb the lens. I had no injection this time. I think that was a bit of a prophylactic for infection. Very comfortable. Right eye had a slightly different procedure than the left eye. It felt a little different.
Yeah, it always, in 99% patients, the second eye You always feel it a little more.
Yeah, well, you know what to expect, right?
Yes, exactly. So when you're the first time, you have a lot of apprehension. When you come and you get it done, you think it's a breeze. It's fine. So when you come for the next eye, your expectation is here. Here's going to be a breeze. So it's not you.
Right.
It's every patient who has a second eye done. They always feel that the second was a little bit of I felt it a little more.
Right. Yeah.
I had a little more this thing, that thing.
The correction that we've done,
yes,
because it's based on where my eyes were at this stage of my life,
yes,
the lenses there are going to hold that in place.
Yes, it will.
Okay.
Because we do not expect any major changes for distance at this age.
Right.
We only expect the near number to go on increasing.
Right.
That starts at 40 and then it goes up till about 60, the age of 60.
Right.
But the maximum that it will increase, that is already incorporated in the lens.
Okay. So, we were discussing that the design of the panoptic is based on concentric circles.
Yes.
So therefore, that correction is built into
yes,
the way that the concentric circles are.
It is.
Oh, fantastic.
So that will not be a problem for you.
Okay.
But yes, in the eventuality that maybe a little bit of, for some unforeseen reason, if you do get a slight distance number or something later on a few years down the line, it will not be that much that you would require glasses.
So I just wrapped up my briefing with the optometrist. She's lovely. And I really appreciate all the information she gave me. These lenses I got, they're panoptic, they're top of the line, they're trifocal. She informed me that, as I did mention, that the cataracts were starting to form. So as much as it was initially for my vanity, they said it was good to get ahead of it because the inevitable was going to happen and these would have. So I'm very thankful for that. The other thing that she did mention is that the only other risk with some coma and just routine checks on my eyes, again, we all have to do them as we age, they will detect that, and any sort of issues around that, they can treat it by turning 60 shortly, and I'm giving myself the best chance to put my best foot forward, and I'm very happy about that. So let me get dressed and start to wind my way out of here, and I got this patch on for another 4 hours. For transparency, the optometrist just came in and explained to me some of the things that went on this morning, and this is the older center. This is the original one. This one started in 2015. The one in Green Park is a lot newer, and they tend to see a lot more of the local patients here, while the Green Park is that they do more with the medical tourists, such as my son. And I'm really appreciative of the explanation that she's provided me. And any of my trepidations that I may have expressed earlier, totally unwarranted, but again, it takes a little while to get used to the organizational culture of how this works. It works really smoothly once it gets rolling, just like the Canadian healthcare system. I know people complain about it, but once you're in and things are working, it just works smoothly, just exactly like this. And everything has been absolutely professional. Surgeon, Dr. R.P. Singh, he was so good. He really, really was. So I'm going to be heading out home, and there's a lot more to this video to come. So keep watching. And I am ready to roll. I'm going to got my sunglasses ready to step outside, and got to get out of here. I need to get discharged, and that's the first step. I have to go and pick up some antibiotics. The first course was for 5 days. This course is only going to be for 3 days. And there you go. That's all I need from that. Okay. Then I ride. There's a surgery. Not as traumatic as most people think. My recovery from LASIK, I was able to see fine by the next morning. It did feel like sand in the eyes, but the procedures have improved. 4.92 on Uber. Not bad. Just straight ahead and to the right, you'll see a white hut. Go just to the end. And there we go. I managed to leave, get my Uber all on my own. Quite something that, you could have something that may be considered very invasive surgery and have this level of flexibility. Okay, it's 11:51 and I still have about an hour and a half or so with the patch on. So I am here in the living room. They have a little fountain over there. The birds are chirping in the cages, and I know, like magic, I'm going to have a snooze here. So I will check back in and show you what it's like to take a patch in a while. It's just after 1:30 here, and I know I could have taken this off about 15-20 minutes ago, but actually, like magic, the powers of this couch had me snoozing in no time flat. I'm going to take this off right now. So get in here. There you go. There is my eye with a whole new lens in it. Let's get into my regime that I have to do that is critical for the first day, the first week, first month, the 3 months after the surgery. I'm back, and it's 24 hours after my second surgery. As you can see, the eye is still dilated, and keeping the eye dilated for a week is part of the healing process. I have 2 whole new lenses now. I am a bionic man, and I could not be happier. I'm going to be glasses free for hopefully the rest of my life, and maybe even I may need some reading glasses. But I need to go over a few things here for sake of transparency. As I showed you before, I did go to Visitech, and in India, one of the things that you do get is you have to keep your own patient record. Obviously, I'm a foreigner, so it makes the burden even just a little bit more. But let me break down the whole process here for you. First thing that you do is you go for a consultation. You have to book an appointment, costs about 1,000 rupees. They check to see if where you're at, to see if you have any glaucoma or cataracts. Most of the screening initially is to assess if you're diabetic, because diabetics do have more problem with glaucoma. You get this little list here, and I take a picture of that too. And the protocol is that you have to get your check for blood sugar, urine RM, which is also checking the sugar in your urine, and you also do an ECG. Take a head bath 1 day before. Do not get water in your eyes. And so you have to come up with some sort of strategy, and that's the reason why I took off the beard. If I have to wash my beard, it's really close to my eyes. Also tell you, don't use any face cosmetics, moisturizers. They don't want scent, and also things that may interfere and get in your eye. You have to use Kitmox or Moxagram in your eyes, which is an antibiotic in preparation for the surgery, and you do that 3 times a day. This guy here, that's what you have to do. And when you are ready for the surgery, you got to dilate the eye, and you have to take Tropicacil plus eye drop. So that there is to dilate the eye. It burns like a mofo, I'm going to be quite honest. But you know, it's not unbearable, right? But it does burn, and you get used to it. But this is literally what you're starting to take every 15 minutes, an hour before you're there getting prepped for surgery. And they ask you to report on time. Obviously, you have an appointment for that. So that's your protocol. I keep track of all my numbers. I knew I was going to be good. My blood sugar level is really quite good. For a guy turning 60 this year, I'm doing okay. So now that I have all my tests, I've done my prep. On the day of surgery, you go in, and the first surgery, they gave me antihistamine injection, because one of the things that you have to deal with is having to deal with allergies in the eye. And they said that usually lasts 6 months. So when you get first injection, it's good for the next surgery. Then you have to change your clothes. They do another check. They want to see the center of the eye, and also to validate if the lens is properly where it's going to be placed, and if everything is in check. It's a cross validation, so you do that little thing where you rest your chin on the machine and get everything focused on there after your eyes have been dilated. And they still keep doing dilation on it. And if you don't have any cataracts or glaucoma, most of the anesthetic is local. I didn't have to get an injection. There was a gentleman in my first surgery. He was getting a needle to the eye, and he was not happy about that. So again, if you want to stay on top of these things and are interested in surgery, really get ahead of this and consider it earlier rather than later. Most healthcare systems and most health insurance do cover it only when it's become a problem, and you're going to get the cheap cheapest fucking lens. It does tick me off because ideally you should really get the best possible lens you can. I did. I know it's my privilege. I know it's something that I'm investing in, but sometimes for me, if I'm going to live with this for the rest of my life, I don't want to have to go back and think I should have got the best possible lens I could have when I could have. So I'm doing it all in one go. And then the surgeon does come out to you after you've gone through the initial protocol, and fantastic bedside manner. Dr. R.P. Singh, thumbs up, double thumbs up, and a circle for those people who remember in living color. And he was so good. Can't recommend him enough. As a surgeon. He got me really nice and calm. They do a slit in the center of the eye. They rip out they take out the old lens, and then they implant the new one. So you now have a foreign object in your body. And so that's something that your body takes a while to get used to. Because if you have a foreign object in your body, the initial thing is reject. So there is that process that you go through that you have to think about. So after the surgery, they put a patch on your eye. It's kind of funny. I did feel very much like a pirate, but Pirates of the Caribbean. Hey, sorry about that. But you only have it on for 4 hours, and by the end of that 4 hours, when you take it off, it's a minor irritation, but it's quite comfortable. Like I had LASIK before, so I know what this feels like. And you get a protocol after. One thing I want to emphasize is each time you get a lens in India, and you should get this globally, they give you a proof of what your lens went in, so that way you can validate that, and if you have any problems with it, they stand behind it. Not bad. All right, so here's your protocol after that. You have to take an antibiotic. So I'm taking Ziplocs. First time you do it for 5 days. If you do the second surgery, you're just going to most probably take it for 3 days. They also give you Diamox, which is what they give to glaucoma patients. It's sort of a catch-all drug, but you are going to be a little disoriented because you've had surgery on your eye. And that's just to get you over that hump, maybe a little bit of nausea from motion sickness, and also just getting used to it. So usually the first time you got 3 tablets. This time they only gave me 2 tablets. I'm not too sure what it did, but I'm generally quite fine because I have a very good sense of balance. I really do work on my proprioception. They gave you a painkiller, anything like paracetamol. That's what they gave me. And by the way, this is what the antibiotics looks like, basic Cipro. And then you got the eye drops. And man, you got the eye drops. 2 main ones, these two, the troposamine, and you also have the thymol malate, Tropac, the tropicin for 5 days, and you do that 3 times a day for 5 days. This one for a week, twice a day. 3 times a day for 5 days, this one for a week. Keeping the pupil dilated is part of the healing process because, again, you want to make sure that the eye is getting more relaxed and comfortable getting used to the new lens. That's the way it was explained to me. And then you have, for the extended period, Moxicip D, which is before you had Moxicip. Now you have Moxicip D, which is this guy here. And that is a antibiotic that you put in. And that goes from 6 times a day for 1 week to 4 times a day for the next week, to 3 times a day for the 3rd week, and then to twice a day by the 4th week. As I said, I'm staying in House Cast, which is right near the Aurobindo Market, which is one of the original markets here. So all around this area, there's a lot of medical services, and man, they work fast. As I said, I had to get an EKG and the blood sugar and urine RM test, and there was a series of clinics just over the road there. I got that literally, I walked in, got an appointment, and all told, that was about 520 rupees. The EKG was the most expensive of the lot. That one, because it takes most time, and it also requires a technician to interpret the results. And very effectively, it was a very efficient system, I should say. They sent me my results via text and a link that I could go and download my reports. And those were the ones I provided to the clinic, which supported them in their decision to proceed and how to proceed with my surgery. So today I'm just, as I'm navigating Indian traffic here, which is always a fun thing to do, I am doing my 24-hour follow-up because with any of these eye surgeries, that 24-hour period is most critical, and it is the time when things could go the most wrong. You could assess to see how well things have settled in place. Again, the little things that you do to figure out how to walk around here. This is how close it is. I go 3 more blocks this way, and there was the eye clinic. Look, I know enough people who live in Canada and even down Australia. Anytime they go to Mexico, holy shit, do they get a ton of dental work done. Because you know why? You have all of these Mexican dentists who have been trained in the US, and they set up a practice in tourist towns, and you get every bit as good a service as you would in the US or Canada, down in Mexico, and you get it for a much more reasonable cost. Because if you don't have dental insurance, dental work is incredibly expensive. I'm approaching the Green Park Clinic here. Yesterday I was out on the one on the east part of Delhi where I got the surgery done. My first surgery I did here at Green Park. Facilities here are a lot more modern for those of us who don't speak the local languages here. It's very comforting to know that any of the communication issues that you may encounter are addressed with a greater sense of clarity. It's right near the Haldirams, which is famous, and really, if you do like Indian sweets, really good. The clinic is right there. O-H-U, RTP, NLFE, TLPLF. You see? There you go. Within 24 hours and 2 surgeries, I get a good bill of health. I just want to show people that you can do this. They are a super specialty eye hospital and a unit of Jasola Healthcare. So when you see the bills that I have, they are from Jasola Healthcare. And again, you know, very, very normal, very clean, professional offices. There's the administrators. They run a very tight ship. And here's the scope of services that they offer. The surgery is right back there, and very well run, exceptionally well run. So there was my 24-hour assessment. Pretty happy with how things went. I just really love what modern medicine is able to do. I'm most ready to spend way too much money on sunglasses now. I know, it's, I do enjoy playing with my appearance. I will be beard-free for another month at least, getting my lenses replaced. It's also another opportunity for renewal on the verge of my 60th birthday. It is now Thursday after my surgery on my right eye. So I now have 2 new lenses in my eyes. And as I am taking off from India today, this is now the 7th day after. I do have a follow-up appointment here at Visitech. Let's see what they have to say. HU, RTL, that the lag time between adjusting from here to looking at you and looking off in the distance is dropped dramatically, right?
That's good.
So my brain is getting used to the new lenses.
Yeah.
Any other things I should be looking out for? Okay. It's just the time for my eyes to get used to having a foreign object in it. The other one is rubbing the eyes, and that's another 2 weeks.
Touching of the eye for 2 weeks because it is prone to any kind of infection which we want to avoid.
Right.
So that's about it.
Right.
Otherwise, eyes are absolutely good.
Right.
And we are very happy with the results. I hope you are too.
I'm very happy.
When are you leaving now?
I leave today,
Leaving
and
for Canada? Or?
no, I'm actually going on to Georgia first.
Now all the best.
Okay, thank you very much.
A safe flight
All right.
and for a good time ahead.
Yeah.
Meet your friends with new eyes.
Yes, and I will, and the video will go up, and I am hoping that other people use the opportunity to come here and do this.
Wonderful.
Right? Because I've had the best experience with this.
Thank you so much.
I am on my way out of here.
Bye-bye.
Okay, bye now. Clean bill of health, and my eyes are great, and I am good to go, and I'm officially discharged. And Visitech, you did a great job, and I have new lenses for what will be effectively the rest of my life. What a wonderful way to invest in me, turning 60 this year, and also setting myself up for success for the next 20 to the rest of my life, however long I live. I leave India with better sight than I came with. I indulge a little bit in their medical tourism unexpectedly, and I hope that doesn't pose any problems for me in the future. And I also lost my beard as a result. With my new vision, I'm going to go out there, taste the world like never before.